College's Community Conversations on YouTube. McCall College offers specialty higher education to all ages in the West Central Mountains. I'm Dr. Bryan Williams, and I will serve as your moderator tonight. Our May focus for our community conversations is pandemic-related mental health concerns. Our series goal is to offer education on mental health problems in our area, to offer strategies for coping with those mental health problems, and local and regional resources for help. This series is sponsored by a grant from our Region 4 Behavioral Health Board. We are so pleased tonight to introduce you to one of those resources that's brand new in our community. It's called ROC. It's Recovery Oriented Community. And to represent ROC, we're pleased to have Jada Haney join us and be our conversationalist today. Thank you, Jada, for agreeing to be a part of our conversation, and welcome.
Thank you for having me.
Thanks so much. Can you give us a bit of your background that brought you into this field?
I was kind of nudged into this type of work because I'm also a person of long-term recovery. And after finding recovery, I decided that I wanted to be the person that I needed when I was really struggling. So the ROC has really given me that opportunity to share my story and personal experiences to help others instead of being shamed for it.
Oh, that's wonderful. Can you give us a bit of history of the ROC?
So the ROC is pretty new in Valley County. We're a branch from Pure Wellness down in Boise, who's been around for about 5 years, but the ROC has only been up here since October. We are a nonprofit organization that is a peer-based community and is just for people searching for recovery in substance abuse disorder, process addictions, mental health, and other issues that they may feel like they need help with. That is just the basis of what we are. And I've recently started in February. Since then, I have seen our numbers double though.
Interesting. Have you sensed that that the McCall operation will be different than the Boise operation? Is there, or is it really quite similar?
They're very, very similar. We're just a branch off there. They also have a branch up in Kootenai County. We all provide the same exact thing, do basically the same exact thing. The only thing that varies is the type of groups that we hold, and the type of activities. Sometimes just because we're a more rural area, we're able to do a lot more outdoor physical activities than say down in Boise.
Very good. Well, we're certainly glad you're here. In rural Idaho, we are so appreciative of the resources that arrive. And we certainly want to welcome you to our area. Do you have other staff members other than yourself that are joining you?
As of right now, we have one more staff member that's up here, and his name is Kevin Daughtery, and he is our administrative assistant and is currently going through the recovery coach training to join me as a recovery coach.
Great. Well, and so tell me what your sort of role is now as compared to Kevin's role.
So I'm the program director and coordinator of the ROC. So I kind of just facilitate groups. I do recovery coaching sessions, which are just one-on-ones with people. I help with events and keep track of our numbers and things like that. Difference just between me and Kevin is that I have my certificate and he doesn't yet. And so that's just something that we're building on and working towards so that he's able to also help people as much as he wants to.
Oh, that's great. Well, we're glad you got help.
Yeah.
And so that's great. And so the other day, I decided to do a walkthrough just so I could know about your organization, and I learned some things. And so I was glad. And so I sat down and did a little video of my walkthrough. I'll invite you to turn your camera off and let's look at that little video.
We're here today to discover the home of the rock. We begin our journey at the Park Place Professional Center, where the rock has recently allowed. Park Place Professional Center is the home to many organizations that are helpful to those in recovery. Organizations such as Central Idaho Counseling, chiropractors, healing and health specialists, Trinity Home Care, St. Luke's. We've got massage therapy. McCall College is here. We have caretakers, Rose Advocates, yoga, Jamie's Place, Plowshare, counseling, McPaws, and the rock is located on the east wing of the second floor. If an elevator is needed, there is an ADA certified elevator that will get you to the second floor as well. Welcome to the rock. Come on into the rock. And we're here with Kevin. Kevin, introduce yourself.
Hello, I'm Kevin and I work at the ROC. We're a peer-based recovery, and how can we help you with your recovery today? But if you could sign in for me, that would be great. It's a volunteer program. We do community service if you're interested. So here is our group room. And this is where we do all of our groups this week on those weeks. As you can see, we do the rolling board. But we have a lot of fun here. We have a resource board over here. And that helps you with housing, recovery, jobs, transportation, food, and clothing, you know, about it. Then if you follow me over here, this is our lounge area. If you ever need anywhere just to come hang out and just chill, just relax, take a break from the normal world, this is it. We got great material, everything. It's a fun place. People think the chairs are comfy. This a little snack room. We got a bunch of food in the fridge, snacks, coffee, another little lounge area. Got some stuff you can draw on if you want some more reading material. Then we got computers with computer access over here. You need to come in and do any computer work and get hooked up to a printer, but this is really convenient for people that don't have computers. Then here we got a library, and pretty much just take a book, bring back moments of life. But I think that's about it. We're not that big, but we do a lot of big things here. But if you have more questions, feel free to ask.
Thank you. I really appreciate the tour and for letting us see what the rock offers to our clients here in the region. Thanks, Kevin.
I really appreciate Kevin doing that for us. And was there any other any other issues you'd like to highlight about your physical building and what it offers?
No, not really. Just letting everybody know that it is a place for the community to be able to utilize. And we do have a lot of different things that people can use here in our office.
Yeah, what I think what I was I was surprised by was your computer stations. And that's really a need in our community is helping people with computer resources. And so that there was just lots of good things there, but I was particularly pleased to see the computers. So let's talk for a minute about the problems in our region. What problems do you see in our region that ROC might be helpful in addressing?
Well, the problems that we see here is like many rural areas, there's just a lack of resources for specific groups of people that may need help. In Valley County, it seems as if there are a few resources available for people struggling with substance abuse disorder and other process addictions, as well as mental health.
Thank you. And so will your focus be there, or is as far as substance abuse, do you sense that's sort of the main focus that you'll be working with?
Our main focus as just a recovery community is, substance abuse disorder, but as well as just people struggling with many types of addictions or mental health disorders, if that is a process addiction or something else. They can definitely come to us and we'll try our hardest to help as much as possible.
That's great. And so one of the things about tonight is my wife Lynette, who goes by Nettie K, who is running our production. I've invited her to join us. And so Lynette, you had a question.
Yes. Hello, everybody. I am just wondering, the process addiction, what does that entail? What is that? I've never heard that term before.
So process addictions are more physical addictions such as gambling, sex, things like that, self-harm. So that is a process addiction, and that's the difference between a substance addiction and a process, is that it's not necessarily something that you are intaking into your body, but something that you're just doing.
Okay, so like if you have a shopping addiction, would that could be part of it as well, like shopping? Do you do that? Yeah. Okay, good. And do you guys meet in groups, or is it mostly one-on-one?
We offer both.
Okay, so are there like specific times that you meet, or is it just?
So we do have meetings every day, and you would find that schedule on our website underneath peer-based community groups. And then the one-on-ones are just whatever works for everybody. I'm available most of the time, and that would just be a you and me type of thing in our office compared to our group settings, which are groups with many different types of people.
Okay, good.
Goodness. And what I picked up one of your brochures on the counter here in Park Place, and I was fascinated that you had a comment about isolation. Mm-hmm. And now that we're coming out of the pandemic, how do you guys sense that isolation might be something that you folks might be able to help with?
Isolation was just really a big thing during COVID, and once people are isolated and in that mindset, they are a lot more vulnerable to feeding into addictions or just having negative self-talk leading to some more mental health issues. And so we help with that by providing groups and events for people to attend that are healthy and positive place for people to go to.
Oh boy, that is so helpful. So we appreciate you doing all those things. And so as you look around our region, I hope you don't feel too lonely, but we don't have a lot of organizations that do what you're trying to do. What kind of organizations are we missing?
So the nice thing is that we are aware of a lot of resources like AA, there's the Change Clinic, Central Idaho Counseling, Mobile Medicine, YCAP, and the food banks, but there are so many people in Valley County that do want help and are finding their voices. So we see that we are lacking things like long-term treatment up here, as well as the living situation. There is no transitional housing for returning citizens, and there is very little low-income housing that's available up here. So those are kind of our bigger things that we do see, as well as transportation around Valley County, because Cascade is a little bit farther, as well as New Meadows or just the outsides of Valley County. It's really hard for some people to get transportation to the ROC or these other resources in order to get the help that they are asking for.
Yeah, that was part of your resource board, which I thought was a wonderful addition, because we really are struggling in those areas. And so as far as housing and jobs and all those areas, so boy, that jobs board and the resource board, housing, boy, I hope that's a busy part of the ROC, because we sure need it. That's for sure. Was there any other professionals that you thought might be helpful up here? Folks that are trained in areas that we don't seem to have a lot of?
Most of those professionals are just a part of the resources that I did. Like there's Misty down at Central Idaho Counseling. People like that, they usually work for these organizations that are already here, and they're very, very helpful people.
Excellent. I'd like to take you to how you might be able to offer some help in this area, and what solutions that might be able to assist. What are your plans for dealing with some of these problems?
We plan on tackling these problems by creating an accepting environment, linking peers to existing resources, and being an advocate in our community that educates and reduces the stigma surrounding mental health and substance use disorder. So we utilize the success, skills, and support of volunteers and employees who have lived experiences with mental health and substance use disorder to deliver peer-led and peer-delivered services. So those services include daily groups, one-on-one sessions, and sober activities.
Excellent. And you've also said volunteers. What plans do you think you might have as far as growing a volunteer community?
We offer community service here as well as volunteers, and we have many of those people that we enjoy and hold dearly to our hearts. They're just people out in the community that have rather seen it firsthand or have a family member or friend that has struggled with substance use disorder, and they just want to help out and see what they can do. So volunteering is talking to somebody, being here, making our recovery calls, things like that.
Oh, that would be wonderful. I hope folks that are listening tonight will sort of file that away as a place that they could help, and help you create your community. Would you describe the community that you're trying to build?
So the community that we are trying to build is a culture of wellness and positivity that supports long-term recovery for those who face challenges from mental health and substance use disorder. We kind of want to get rid of that stigma that it's voodoo or just bad, and give them that voice that everybody I think deserves.
Wonderful. So if I were to walk into a room and you've got an awful lot of your folks in that room, tell me what I might see. What would the age range be that you'd love to have in the room?
Well, we serve all age ranges, and I just love seeing anybody that's just searching or trying to help out with others. So we serve people 18 and older as of right now.
Okay.
Just from all different types of life too.
Okay. If a mom has kids, a dad has kids, have you been able to set up anything for them, or is it just basically adults?
If people have kids, we work on that kind of case-to-case basis. More of our evening groups, we do have staff available to kind of work with that so that we can provide them to have groups and then the kids to be in another room.
Okay. Do you try and do much assessment of people, of folks around that are coming to you to try and sort out what's going on? Is there an assessment that they might experience fairly early on?
Since I'm not a clinical provider, I don't do assessments like that. I am not somebody that has that capability, but we do get to know people within their first couple of sessions and see what they're struggling with, what they're looking for, and how we can help them.
Oh, that's appreciated. So thank you. Now, in the in our community, we have Alcoholics Anonymous (AA) has been here for a long time and has served our community. In the past, they've had two groups, and I'm sorry I didn't look up whether we still have two groups, sort of a morning and an afternoon, I believe. How would you compare yourself to AA, and what are your differences?
So AA has been an established support system for quite some time, and it has showed amazing success. We don't compare ourselves to AA or other support groups, but we do just say that giving people alternatives to their own recovery is a main goal of ours, and we support whichever road our clients choose to take. A really big thing here is that what works for me in recovery may not work for somebody else. So we just support them to find what does work best for them.
Sure. And I know some of our churches have tried to create some recovery. And so there's been this ongoing need in the community. And so it's nice to have one more alternative that you guys are bringing in with a wonderful environment and a wonderful professional look to it. So thank you. Finances are always a challenge for folks. Often the people that will be sitting around the room may be struggling with money. How are you guys funded?
So we're funded through Valley County Opioid Response Program, or V Corp. And as a nonprofit, there are no charges for the services we provide.
Oh, it's free.
Mm-hmm.
That's good news. And so are there any expenses? Let's say you sat down at the computer and you needed to print out something for a job. Would there be fees or anything like that that would be attached that they should be ready for?
No, nothing that we do here in our facility has any sort of fees. If they were to do long-term treatment at a different facility or something like that, then that would be based on that facility's fees and everything. But here at the ROC, everything is free.
Free is good. I think I find that really helpful. Do you have an online capacity, like right now we're on Zoom together so that we can meet, or do you like to do everything face to face?
So we do have an online capacity. We utilize Zoom for our groups and a secure website clock tree for our one-on-one sessions. We also do offer everything in person. So it's really just whatever is convenient for each client and what everybody feels most comfortable with.
Okay. As we're coming out of the pandemic, is there anything related to the pandemic as far as masks, distances, anything else that people should be aware of as they come?
We just follow all CDC guidelines.
Okay, that's appreciated. How would you like to grow? We want you to grow, and so your success, I think, would be helpful to our community. And so growth, we hope, is vigorous. How would you like to grow? And is there steps that you're sort of sensing that are give you a sense of your own personal success or corporate success?
We would just like to reach as many people as possible in Valley County and hopefully one day Adams County, and anybody that's nearby that just doesn't feel like they have the resources. It is a very rural area, so there are people that fall out of the counties, and we just hope to be able to reach them through lots of flyers and working with other people in the community. And we just hope to kind of make some partnerships here coming soon so that we're able to reach out to those people that are struggling.
Excellent. Do you have a presence in any other community but McCall?
So not the ROC necessarily, but like I said earlier, Peer Wellness is down in Boise, and then they do have a center out in Kootenai County. We try to work with as many people as possible. So if there is somebody that's a little bit farther and they do reach out to me, I'm very open to that. And I know that so is Boise and Kootenai County.
Okay. So right now, you're happy to Zoom with anybody in our region. Mm-hmm. If they need face-to-face, it will necessitate coming to McCall. Is that sort of what's going on, or is it?
It's definitely based on each client, if there is a place that they're comfortable meeting out in public, then I am able to travel to Cascade, Dunley, other areas.
Oh my, okay. So that's just option somewhere in the future.
Yeah, and we also do
that,
provide
that-
transportation.
Excellent. Okay. Tell me about that.
We use our personal vehicles. You sign a waiver, just agreeing to a couple of things, and that if there was an accident or something, the waiver is signed. It's just for our liability and everything. But if you do want to attend a group or an event or something like that, all you have to do is just get in contact with me, sign this waiver, and then I'm able to transport you from wherever you're at to the ROC facility. Or
Wow.
if it was a meeting that you needed to go to, you need to go see your probation officer, just things like that that are really going to help you in your recovery and everything. We are very, very open to working with you in order to provide that transportation.
Right. Would that be done on a website, or would you prefer that be done personally?
So that's a personal thing. We don't have any options on our website for that, but that is a personal thing to just reach out to me.
Okay. Oh, that's wonderful for so many people. And so now let's take a moment and sort of try and understand the goals you have for the folks that you're able to work with. How do you establish and track goals for your clients?
So that's very interesting. And I think that's something that kind of differs us from other resources is we don't establish any goals for our clients. They establish their own goals for themselves. And as we work together, we work as a team to see what resources that we have access to that could help them accomplish these goals for themselves and support them as peers through their journey to help them be as successful as they see themselves.
Excellent. So that's really individualized then, so that you're looking to get to know them, you're wanting to understand where they want to get to, and you're looking, my sense is you're trying to be a partner in helping them achieve their own personal goals. Is that a fair assessment?
Yes, absolutely. We just want to work as a team and be a peer-to-peer support in order to help them achieve those goals that they make for themselves.
That's appreciated. Thank you for doing that. So have we missed anything in this journey or this conversation tonight? Is there anything else we need to get on the table to make people understand your organization?
No, I feel like you've definitely hit everything. I just hope that anybody that is interested in checking out the ROC does reach out.
Oh, I hope they do. Was there anything, again, this is live TV, so was there anything that you'd like to restate or adjust on anything we've talked about tonight?
No, I just wanted to say again that we are open to everyone in the community and we are here to help others connect to people and resources around Valley County that not everybody may know.
Great. Well, let's get some information into people's hands. So if you'd like to grab a pen, if somebody would like to take down some of this information, and give us your contact information, your address, and your phone number, I think would be really, really crucial. And so let's start there. Let's start with the address of the organization.
Okay, so our address is 106 East Park Street, Suite 227, McCall, Idaho 83638.
Great. Your phone number that you like to use for business purposes?
208-278-7977.
Why don't you restate that?
It's 208-278-7977.
Thank you. Is there a web page that they might be able to go to find some information?
Yep, so it's just www.theroc, and ROC is spelled ROC, .center.
Ah, okay. So THE, this is all one word, THEROC
Yep.
.center.
Yes.
Okay, so that's, and when they go onto your webpage, what might they see?
So they'll see our homepage, and then they'll see also a different couple of options. And on our website is where they would find our support groups, as well as if they wanted to reach out and contact us, there's a place for them to be able to do that and subscribe to our webpage. Some other things are just what we're about, our staff here, our CEO, and a couple of other people that we work really closely with, and just a place for them to be able to ask questions if they have any.
Okay. And is there an email list or something that they could sign up to find out what's happening?
And that would be when they subscribe to our website.
That's subscribing to the website. Great. What are your normal hours of operation?
So on Monday, Wednesday, and Friday, we're open from 9 to 5. And then on Tuesdays and Thursdays, we're open from 10 to 7.
Okay, so your extended hours. And would those operate, would that typically, is that sort of cueing us that your evening events will probably be Tuesdays and Thursdays?
So our evening groups are on Tuesdays and Thursdays.
Okay, so tell us about your regular events that people might be interested in.
As of right now, our regular events are just our daily groups. And again, you can find that schedule on our website. And some events that we're planning for that are going to be pretty annual is we do an annual recovery month for September.
What might happen then?
We have a committee right now, and we're kind of working on that. We down in Boise, they usually do a march from the state capitol down to one of the parks, and then they kind of hold a fun little event with vendors and music and everything and speakers. And so we're looking at something possibly like that, but we're just in the works of it right now.
Oh my, but September might come terribly quickly. So I hope you're successful in making something like that meaningful. I think that's important for people to enjoy something like that. Thank you. This has been a really, really good conversation, and I'm glad you're here. And I really want to thank you for taking the time to come and explain the ROC to us. It's really a new concept for an awful lot of people. And so I trust that this conversation might be able to be of some help to those. And so thank you. Well, that brings our conversations for the spring to an end. And so we've had a wonderful time. And if you've been tracking us, you saw that early on this spring, we had a great conversation on vaccine hesitancy. And then we moved into this 4-part series on pandemic mental health. And I've learned a lot. I trust that you've had a chance to learn a lot as well. And so if this is your first video that you've had a chance to watch, we trust you'll go back and look at those conversations that we've had here in the month of May. And we've had some great folks that have been very, very helpful in helping us to understand pandemic mental health in our region. We're planning to take June off. And so there won't be any community conversations happening during the month of June. And so we would then welcome you to a summer series. And so our summer series will be starting on July 1st, and it will flow from July through August. And Nettie K, I know her as Lynette, but she likes Nettie K, and her students call her Nettie K, will be helping us with art education. And so I'm looking forward to YouTube Live Art Education from McCall College. And so that's an important summer activity that we're really looking forward to. Next fall, we're planning to bring our GED courses to YouTube. And so if you know someone that's looking for their GED, would you please let them know about what's happening in the fall at McCall College? And so anyone that's thinking about the GED or wondering about the GED, or anyone that's really struggling with algebra, that's the focus that we'll be working on in the fall, is helping students get their GED math exam under control. And so if you know someone that's struggling with Algebra 1 or Algebra 2, then they would certainly be a candidate as well. So we're looking for all the GED students in our region that would like to address the math problems that inform the GED, or anyone that wants to sharpen up their Algebra 1 or Algebra 2. So make sure they're aware of it. Thank you for watching our community conversation on YouTube. We trust you'll subscribe and share so that you'll be aware of the events that are coming, as we have lots of plans for community conversation in the future, and we'd certainly like for you to be a part of those plans. If you'd like any more information, McCall College is at www.mccallcollege.org. And so that's where information will be. So again, thank you for joining us for Community Conversation.